We have a patient with a displaced cervical vertebra. He lifted a heavy bag and twisted his neck because of it. Now we'll see what happened. Right now, he can't turn his head. He can turn it that way, but not this way. It doesn't turn this way. It leans forward. Backwards? Backwards. Only to this point. Further. Pain appears further. The pain radiates to the arm, right? Somewhere up to here. The pain radiates to the left shoulder. Let's see what happened now. We're looking at the range of joint movement. First, we check the back for any neck asymmetry. If there is neck asymmetry, that is, he sits in such a way as to reduce the pressure of the core from this side. We look at the range of motion of the very vertebrae. Lean your chest forward and back. You can see that the movement is asymmetrical. Forward and back. Here there is fixation of the joints. There is no movement between the joint surfaces of the vertebrae. Now we will definitely determine at what level the compression is, at what level the compression of the nerves is. For this, we will take a look at the deltoid muscle, because we roughly assume that the compression is somewhere at this level. We are testing the deltoid muscle, upwards. Weakness of the deltoid muscle, upwards. Sign of nerve root compression. Just in case, let's test the other one. Up, they're not working. The other one is working. Now, to determine the nerve compression at the level of the intervertebral disc or at the level of the scalene muscles, let's take and move the vertebra to one side. Now we are shifting it to the left side and simultaneously testing the muscles. Nothing is happening. We're moving the vertebra to the other side. Testing the muscle once again. The muscle is getting stronger. Or another way, we take it, turn his head slightly in the position where I will manipulate one side or the other. We turn the head to one side, we test the muscle. There is an increase in the muscle. We turn his head to the side and test again. And the weakness of the muscles increases. So I will do the manipulation in this direction, this side. Okay, let's go. Checking one more time just in case. Which side? This one. Checking one more time just in case. Up, I'm getting muscle strength. Now I'm finding the fifth vertebra and manipulating it. Let's check what happened with this muscle. We got a strengthened muscle. Let's check motion range. Let's try, let's move. There is an increase in the range of motion in this direction. We got an increase in the range of motion on one side. We removed one level of compression at the level of the fifth intervertebral disc. Now his range of motion has not increased yet. He can't bend his head back. Now let's see if there are other levels of compression from the other side. Bend the arm down, leg up, down, back, down, down, down. Lie down on your back. Let's see in this way whether there are any limitations in the movements of the joints. Any pain? Yes. Now. Yeah. What about now? No. Here? No. No pain. Now go here. I can't lift my head. The upper thoracic vertebrae are also displaced. Inhale, exhale, 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 exhale. Sit down now. After all the fixations between the vertebrae have been removed, to activate the sixth flexor, which is still not working for him, we additionally act on the attachment points of the flexors themselves. To make it faster, lie down. We act on the attachment points of the flexor to activate the long neck flexor. We check the length of the stretch. Further, further back, back, and again. Now, the right one didn't turn on, the left one turned on. Back again. There's a bit of pain and resistance here. Inhale, exhale. Back. All right. Thank you. Back again. All right, sit down. Sit down again now. Any pain? Can't hear you. You can't hear us. Bend it backwards. Okay. Now. There is pain on my left side. It makes the progress harder. Yes, it is. The pain. All right. Here we go. Turn your head now. There's more pain right here. Lie down on your back. Okay, a bit further. How do you feel now? There's one more vertebra left. How are you? I'm okay. There's some pain, but it's bearable. Okay. As a result, within around 15-20 minutes, we put a vertebra in its place, removed the nerve compression. Now his hand is already rising. That is, he does not have weakness. The lethivid muscles are working. The volume of movement increased in one direction. To the other side, he can already turn his head without pain, and he no longer has such a dissatisfied expression. Still, there's pain when bending back, but mobility has slightly improved. The neck bends, but less than normal. In general, there is a chance for recovery. So, we had a session yesterday. He had a pronounced limitation of movement in the neck. Today, the movements are free. We haven't done anything yet today. Here, bending backwards, bending forwards. There was still pain when bending backwards yesterday. Is there any pain now? Just a little. Where? Here. While bending back extremely, correct? Some pain here as well. Let's see. Let's take a look at the deltoid muscle. Raise your arm. And let's take a look at the bending at the extreme point. Weakness arises. Yesterday, we failed to complete this manipulation. One vertebra here. Up, up. The pain is no longer here. Lie on your back. Now let's try to remove this dislocated fixed joint that's still here. I tried fixing it yesterday and likely failed due to the swelling. And more thing now. Just like that. That's what we couldn't do yesterday. Let's check now. The muscles are working. Movements are clear. Is there pain now? No. Bend backwards. Move your neck. No pain from bending backwards? No. But there is pain on this side, yeah? Okay, lie down. Let's see what's limiting movement in this direction. Here is a fixed vertebra. One more time, right? No pain now. The pain is totally gone in every position. Movement is freely done forward, backward, left, right. That's all.